Hi, everyone. I had a lovely call with Dr. Nicole Kangas today. She's a therapist here in the Bay Area. She practices out of Lafayette. On the spot, I said, Nicole, will you talk to my followers? What we want to talk about today is where to find support during your fertility journey. Being a fertility patient is really, 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 really hard to do. So I want Nicole to join me and talk about this topic, and there's really no better person to talk to us about that than her. So I'm just waiting for this so I can bring her on live. So give me 1 second. I should be able to do this. So Nicole, can you ask to join me live?
Yes.
Perfect.
Let's see.
I just flipped.
Where will I see the button to join live? I don't see that.
There should be something that comes up that's a request to join me. And I think that Instagram's being funny right now because typically I should get a button too that tells me to add you, but I don't see it today. I usually see it.
Send the request to be an Egg Whisperers live video.
Yes, that's it.
All right. Okay, sent request.
Thank you. Thanks, Steph. There you are. Awesome. Let's rock and roll.
You can see
Let's
me?
do this. You're coming up. You're coming up.
Yes, that's
Great.
it.
Great. We did it. So I'm gonna, there you go. So turn off the Zoom for me. Hi, Nicole. Thank you for joining me today.
Hello.
And happy birthday. It's your birthday too.
Thank you. It is. Thank you so much for having me, Amy. I'm so happy to be here.
Awesome. I'm happy to have you. So tell us about yourself.
Yes, I am a therapist with a specialty in reproductive psychology. So that means that I deal with all things related to infertility and the family building journey.
Yeah. And then where's your practice?
My practice is in Lafayette, which is in the East Bay of the San Francisco Bay Area. And in my practice, I see individuals, couples, and groups. And I also do online fertility coaching sessions with people across the country. And I do psychological evaluations for recipient families and donors and surrogates in the context of third-party reproduction.
Yeah. And what do you think are some of the stressors that fertility patients go through?
Yeah, I think, fertility treatment in and of itself can be super, super stressful. There's so many hurdles and tests and waiting periods throughout the cycle. I think the cycle itself and waiting to see if it worked can be super, super stressful. There's also a lot of other types of stresses that are associated with the process. Sometimes there's struggles within a relationship. So people may cope with the stresses of infertility really differently. So communication within a couple can be really, really important. Sometimes friends or extended family can say inappropriate things or maybe not be there in the way that people need them to be. And that can be really hard. I also work with a lot of people who have very stressful work lives. So sort of juggling all of that can be challenging. And, more recently, I've been seeing a lot of people who are really stressed out about trying to adhere to a special fertility diet or an exercise regimen. And so I really try to work with them around the idea of balance and, perfection is not attainable and not necessary to get a positive outcome. So trying to help them back away from that.
That should be a bumper sticker. I mean, I get these like panic emails sometimes from patients saying, I just went out to dinner. Nicole, will you turn off the Zoom?
Yeah, sorry. I thought that was...
Oh, that's okay. I mean, I literally get panic emails sometimes. Or just mute it.
There we go.
There you go. Cool. I mean, I literally get panic emails sometimes from patients who say, I just had a piece of pizza and I didn't know it had gluten in it. And I get it. I hear that from people too.
Yeah.
So what kind of strategies and tools do you teach patients as they're going through their treatment cycles as far as like how to cope with all the stress?
Yes, I use a lot of different types of strategies in my work. I really believe in a mind-body approach. I know you know Dr. Alice Domar and her work, so I draw a lot on that. So I use things like guided meditations and diaphragmatic breathing and that sort of stuff. I also draw heavily on cognitive behavioral strategies because it's really easy to get caught up in negative thinking when you're going through this process. So sort of, evaluating our thoughts and making them more helpful is really, really important. So
Right.
those are some of the main ones.
Totally. I mean, I talk about building your fertility team, and the T of the team is therapy. And so it doesn't mean that there's something wrong with you if you see a therapist. It just means you're just going to try and have as smooth of a fertility journey as possible by having as much support around you. And some of the things that you're doing right now are online groups. Can you tell us about those, who they're for, how people can find you?
Absolutely. I just started running online groups and I'm super excited about this. I've been running in-person groups for almost 15 years. And I think groups are so important. Women can be so isolated during the infertility process. So this is a way to bring people together and for them to have social support and to meet other women who are going through the same thing. So in terms of enrolling in the online group, people can reach out to me. They can reach me at my email, which is Nicole at Dr. Nicole Kangas. They can also send me a voicemail. My phone number is 925-732-6878. And I'm happy to spend some time talking to people about whether the group would be a good fit for them.
And are the groups only for people in the Bay Area, or can people that, let's say, live out of state can also join the group?
So anywhere in California, people
Got it.
can join the group.
Got it. And what's the average cost? Like, how much should people expect to pay to be in the group?
Yes, the cost is $50 per session, and I ask people to pay. There'll be 6 sessions, and to pay for the 6 sessions up front.
Excellent. And I know what my patients tell me about, they tell me that they feel so much better having someone to talk to. What's some of the feedback you get from people going through fertility treatment who seek therapy from you?
Do you want perspective from the group or more broadly?
Both.
So I get a lot of positive feedback from people, both who come for individual or couples therapy and people who participate in the groups. I think one of the main aspects is that it can really help to reduce anxiety and stress and make the process more manageable. So people can actually go through it and feel well. I believe in it. I see it all the time where people come in and they're feeling really overwhelmed and really stressed out. And by implementing these tools and having support and having people to talk to, they can actually go through the process in a very different way with a very different mindset.
Yeah. So you can go through IVF and feel emotionally well.
Absolutely.
And
Absolutely.
it's so important for people to hear that. I mean, I do what I can as a fertility doctor, and I know you know how hard it is to hear the numbers go down or things not go the way you expect them to. But if you learn these life skills, because they are truly life skills that you're teaching people.
100%. Absolutely.
Yeah. Yeah. And if you
Yeah.
learn these things ahead of time, when you're going through tough experiences, emotionally you can cope better.
Absolutely. And it's so fun, Amy, to see, some of my patients who I work with on the fertility journey, and then they go on and have pregnancies and have families, and they tell me, oh, I'm using that communication strategy, or they've built, guided meditation into their life. And it's so neat to see they really are life skills.
Right, right, right. Well, Nicole, thank you for joining us today. I really
Thank
appreciate you sharing. I'm glad I talked to you early this morning, and thank you for being available just on the fly real quick to kind of just talk to us about your online group. For those of you who want to see Nicole and join one of her groups, it's drnicolekangas.com, and you can get individual therapy with her and join one of her online groups that she's starting. And then if you email her, she'll tell you exactly when the next group is going to be.
Yes.
Good?
Absolutely.
Okay,
Perfect.
cool.
Thank you, Amy.
Thank you, Nicole. Have a wonderful day and wonderful
You too.
weekend. And thank you everyone for joining us for this quick chat with Nicole. Bye-bye.
Bye.